Right now, two viruses are spreading here in Ohio. We're talking about monkeypox and COVID-19. When it comes to monkeypox, the CDC reports 8 cases now here in Ohio.
This comes 1 month since the first monkeypox case was reported. It was a toddler from Franklin County who recently traveled and wasn't vaccinated. Right now, New York has the most monkeypox cases in the United States at more than 400. In California, people are struggling to get access to a vaccine.
When it comes to COVID-19, we are seeing a drastic spike in cases. Franklin County now in the yellow when it comes to community spread, along with the majority of counties in Ohio. Take a look here. 9 counties are now in red, including Ross and Muskegon counties. We know you have plenty of questions about both monkeypox and COVID-19. We've seen them online, and you really want to know how you can keep your family safe right now.
Yeah, that's why we asked Dr. Joe Gastaldo with OhioHealth to speak with us live tonight. Thank you so much for being with us, Dr. Gastaldo. And let's start with COVID-19. Right now, there are several different variants in Ohio. The latest data from ODH shows the majority of the cases are the BA.5. So what do we need to know about this new strain of Omicron?
Yeah, I would really want to tell people that there's a lot of COVID out there. At OhioHealth, our positivity rate in the urgent care is about 40%. So really, BA.5 is the most transmissible or most variant to date, and we've heard this before. And there's a lot of BA.5 and a lot of COVID in the community. However, although we all are seeing a slight uptick in hospitalizations, it's nowhere near what we had this past winter. And specifically speaking at OhioHealth and at Riverside Methodist Hospital, the hospital is running fine with the patients we have. Really, we are now in the yellow medium community level, and this is really what that means. There's a lot of COVID out there. If you have an at-risk condition, you should be wearing a high-quality mask when you are indoors in public, regardless of your vaccination status. If you're not feeling well, you need to have access to testing, preferably home testing. And if you have an at-risk condition, you need to have a plan in place to get the pills. In addition, for everybody, we want people to understand, we want them to be up to date on their vaccines so they are well protected from being hospitalized or dying.
Yeah, Dr. G, let's talk about the boosters and who should get an extra one, and when do you know if you need one?
Yeah, that's a great question. I know this can be confusing because it changes as we get new variants and new vaccines out. So right now, everybody 5 and older is eligible to receive at least 1 booster. That first booster is 5 months after the second dose, assuming it's an mRNA vaccine. And for anybody 50 and older, they should be getting a second booster. And we really have work to do on that. For those aged 50 to 64, under 10% of those people have only received 1 booster. And for those age 65 and older, under 30% of that age group has received 1 booster. So we really have work to do in taking that message out on who's eligible to receive a booster.
Dr. G, a quick question here. Is it a concern that there could be shock fatigue at this point?
Yeah, there is, obviously. But, you know, we are still learning about the vaccines. We're still learning on really how well the vaccines work in the setting of variants. I know a common question that I get is people are wondering, well, if I get a booster now, there's going to be a newer generation bivalent vaccine booster in the fall. And what we really want to tell people is get that booster now if you're eligible, and you'll still be able to get the new updated booster this fall.
And turning now to monkeypox, the CDC is reporting that we have 8 cases here in Ohio. 1 month ago, we were hearing from the Ohio Department of Health about the first confirmed case here. Should we be concerned that we went from 1 case to now the CDC is saying 8 in the span of 2 months?
Yeah, we should be concerned, and we will see more monkeypox cases here in Columbus and in the whole state of Ohio. You know, we have community transmission of monkeypox. It's nowhere near as contagious as COVID-19, and we really need to understand who's at risk for it. And right now, that's mostly in the community of men who have sex with men. Now, that's the case here in the United States. However, in Europe, we are seeing monkeypox cases in women and children.
Dr. Joe Gastaldo with OhioHealth, always providing some great insight and key takeaways for us. We appreciate your time.
Thank you.